Western Cape Department of Health. Hilary's specialization and field of expertise is public health nutrition. We've heard several speakers this morning have mentioned the great work that's happening in the Western Cape and trailblazing work around the first 1,000 days, and Hilary's going to give us a little bit more of an overview of exactly what this Western Cape First 1,000 Days initiative is all about. Thanks, Hilary.
Okay. While we're putting the presentation up, I'd just like to say thank you very much for the opportunity to share with you the first 1,000-day initiative as we've started to implement this initiative in the province. Originally started with a work around nutrition in the first 1,000 days, and I'm sure some of you have seen that website and a lot of engagements with key people that's here today, David Harrison and others. And from there, this initiative was conceptualized, and I'll share that with you. So starting off, just to say there's a number of people that needs to be acknowledged, and this list is definitely not exhaustive, but growing every day. So I'm going to give you some brief background just in terms of where this fits in, what we are doing, and some of our future plans. So I think we've heard a lot this morning around the science and the importance of the first 1,000 days, and specifically how that relates to lifelong health. And as a Western Cape, we've developed the first 1,000-day initiative to respond to the interrelated challenges that we see in the province, and also to work towards having an open society to all so that we can improve the lives of people in the province. So what are we doing? We currently have 5 strategic goals within the Department of Health, and within government as a whole. And with this, there's a transversal management system which brings together government as a whole, partners and society, and work on these specific goals as it's reflected. With the first 1,000 days specifically fits in with strategic goal number 3, which is increasing wellness, safety, and tackling social ills. The objectives of the PSG3, if I just go back, you will see that's where the first 1,000 days fits in. But within this goal, there are a number of spheres that's being looked at and specific projects within each one of those. And it focuses on safe and healthy children, engaged and healthy youth, resilient and healthy families, inclusive, safe, healthy communities. And I think you will agree that the first 1,000-day initiative really impacts all of those, right from the level of the child up until the community. So within this conceptual structure, we currently have 7 projects, of which the first 1,000-day initiative, as I said, fits in with the safe and healthy children. But this shouldn't be seen as vertical programs or projects next to one another, but really it needs to be complementary, and I will speak to this a bit more in our future plans. So the goal of the initiative is to ensure optimal wellness for children and the community at large. And as I said, the initiative will follow a whole society approach. So we have conceptualized the first 1,000-day initiative based on the work that has been done. Is there too much? Okay. The work being done by the Developing Child group, and looking at the key scientific concepts. Should I rather use the other mic? Okay. Looking at key elements that's needed for lifelong health, and we've adapted it into our context. With this, we've developed a first 1,000-day unique identifier, as you can see on the board, and it basically reflects the bowl reflects the elements of nutrition and health that's important. The heart reflects the element of nurture, care, and support. And then the alphabet blocks that of safety, protection, and stimulation. And in short, it's really about grow, love, play. So we initially started off with this transversal communication campaign, basically making people aware of the importance of the first 1,000 days, and with the slogan, Right Start, Bright Future. We then went on where we have conceptualized and then started to develop a project design. We do apply the life course approach, including, you will see within this is the adolescent period. And then within this design, we focus on 3 main areas, or it's just the way that we package our interventions. And that is a communication strategy, focusing on health interventions, and then also intersectoral intervention. And it's important to say that these elements, again, the one influences the other. We have also in place an operational governance structure. So we have a first 1,000-day executive committee, which is led by the Department of Health and feeds back to structures within health, but then at a transversal level with the other departments at an HOD level. This further feedback is given and reporting, and then ultimately reporting up to the level of the ministers of these various departments that's involved. So these are just some of the progress that we've made to date. The initiative was officially launched in February of this year. And if you look at the transversal communication strategy, what we've done a lot of outdoor advertising through branding of taxis, interior messages also in taxis, sponsored radio interviews and talks, and also some local television recorded interviews around the first 1,000 days, published articles in the Bona magazine and the Sawn, and also developed the first 1,000-day toolkit, which comprises of the badges, which all of you received once, stickers, banners, infographics, presentations, posters, and memory sticks. And if you attend the roadshow this afternoon, and in any case, all of you, we can provide you access to some of this materials through the website that's also up and running since September this year. So we've created the platform for the social media campaign, and we do envisage that we will focus far more on the external communication now in year 2 of the project. In terms of health-specific interventions, we have reviewed specific key health policies. Again, we know that many of the policies only focus on one of the key elements, or in some cases, these are in silos. So we're trying to bring the core components together within our policies, and specifically with our antenatal policy, including some of the social determinants when we do screening in antenatal care. We've also developed a first 1,000-day, or we're moving towards a first 1,000-day dashboard, starting with a national maternal, child, and nutrition dashboard, but also that it actually makes sense to people on the ground when we do monitoring in terms of visualization. There's an adolescent program that's also being conceptualized, and it's currently in process of being rolled out. And then within health, our perinatal task team have particularly also focused on the first 1,000 days. So a full situation analysis have been done, and then following from that, we have developed an intervention and accountability framework. Then in terms of the intersectoral links, innovation, and interventions, we've done a number of roadshows, and those numbers are far higher than what's reflected both in our metro and in our rural areas. where we share the importance of the first 1,000 days, the relevant elements, the concepts, and improve understanding thereof with our internal stakeholders as well as our external partners. We've had a breastfeeding seminar. We are piloting a social impact bond. There's also parenting scoping work that we are doing through our parent, infant, and child health work group. And then the partnerships, collaboration, and active participation and strategic alignment has been ongoing. So this is just some of the examples, and you will also see the website reflected there. And basically, all the materials that we've developed to date is available from the website. So in terms of our future plan, we have now gone into developing a theory of change for the first 1,000-day initiative. And why we are doing this is that we don't sit within health as a small group and just sit and plan on our own, but it's really about unifying the organization, building greater cohesion, assisting us and guiding our decisions and our resource allocations, guiding this change that we're embarking on, and then also highlighting how we need to work together as various sectors. So this process has been done not only with health, but all the other related government departments, partners, NGOs, and we've gone through a series of workshops where we're now at the stage where we think we're close to finalizing the theory of change, coming up with some key activities, focusing on some key levers, and then also developing the monitoring and evaluation plan for this. Within health, we think we have taken the steps of our 2030 vision, the road to wellness, shifting from illness to wellness. We have aligned ourselves in terms of the global strategy within the Survive, Thrive, and Transform themes. The first 1,000 days is key on our transformational agenda, as you can see. And then also, this is just an example of what the first 1,000-day intervention framework looks like, highlighting the pillars, the key support levers, and the foundation. And then also within the framework, we've taken it further, assigning accountability to the interventions. So in terms of the PSG3 process, we're going to focus on 4 strategic focus areas, working together and continuing on these projects. So thank you very much for your attention. I'd just like to also invite you to have a look at the stall outside. We've got Margot Doe here, and you can maybe also view some of the innovative ideas to activate first 1,000 days, you know, because it's one thing to have things on paper, it's another thing to really activate and show action. And then also the invitation is open in the roadshow this afternoon, where the key core elements, the implications for services will be unpacked to a greater deal. Thank you very much.
Thank you very much, Louis. I just really want to congratulate the Western Cape Department on Health on their leadership in this initiative and launching something that is so comprehensive, inclusive and truly consultative. So I think we should give them a round of applause. Okay, so while Tony helps Barry